There is a very emotional explanation to the question that is being asked to me many of the time, that why I have selected autism. And after a couple of years, a mother came to me. She came with the child. He was around 12-year old, a very hefty, healthy child. The thing which I saw that time, it literally shattered my heart. The mother had put a leash on the child, on his waist. The child was treated like an animal. A very, very warm welcome to all the mothers. Gorgeous, beautiful, and most importantly, dedicated mothers. I am Mayuri Ramdasi, founder and creator, Arula for Autism. When we thought of this documentary, I just remembered one song which my mother used to sing for me when I was a child. While doing her work, while making me sleep, while loving me, she used to sing this song. So those two lines I want to sing right now for you. It is in my mother tongue, Marathi. The song goes like this. देव जरी मज कधी भेटला, माग हवे ते माग म्हणाला, म्हणेन प्रभु रे माझे सारे, जीवन देई मम बाळाला, देव जरी मज कधी भेटला. The meaning of the song is very simple. A simple mother, a common mother. She says, if I meet God sometime, someday in my life, and if the God asks me, just ask what you want. You ask whatever you want and I will give it to you. Then I will simply say, hey God, hey Almighty, I don't want anything for myself. But my child is there. Just fulfill all the wishes, all the dreams of my child. Give him everything that he wishes for. This is the natural instinct of every mother. Every mother wants to do best for her child. She wants to give everything to her child. Parents see a dream for their children. The baby is born. Parents start dreaming about his future. In a very happiness, very happily. But you know, as the child grows, something somewhere goes wrong and the dream of the parents gets shattered. There comes the arousal of autism.
Autism spectrum disorder refers to the developmental and neurological disorder. Symptoms are appearing usually at the age of 2 to 3 years. It can get diagnosed at any age. There is a disturbed, delayed social communication and interaction, and there is evidence of a restricted and repetitive behavior. People of all gender, races or ethnicity and economic background can get diagnosed with the autism. There are many causes of autism, such as genetic abnormalities, low birth weight babies, exposure to the toxic drug during infancy. There are few parental causes also, such as the old parental age, maternal history of a viral infection.
But today I want to emphasize on two main causes which are alarming us towards the diagnosis of autism. The first and foremost important cause which I feel is the stress caused to the mother during pregnancy. Now the women are liberal, they are educated, they are career oriented. They work hard to earn for themselves and for the families. So during pregnancy, many of the times the job is continued. They work hard even during pregnancy. And there are many environmental factors. They cause stress to the mother. This stress could be physical, could be social, could be emotional, could be spiritual. Any level of stress. Whether the mother is working woman and having the stress, that also is the matter. But at the same time, the mothers who are not working, the pregnant women who are not working, but the family stress or something, some burden on them. So that is also considered as the main cause of autism. During my 22 years of experience, I have seen that 80% of the mothers go through stress during their pregnancy. So the mother's physical, emotional, social and spiritual health is very important to deliver a baby, a healthy baby. This is one factor. Second factor is increased use of screen time. It could be the mothers working for hours and hours in their workplaces, on laptops, on phones, on other gadgets. The increased use of social media, which causes ups and downs in their emotional status every minute. Even that is considered, or that I feel would be the cause of this devastating disorder. Now let us come to the children. Now we see that mothers are busy. There is nuclear family. Mother is the only one taking care of the baby whole day. She has to go to work, she has to cook for the family, she has to look after the household, responsibilities, everything. And she has to look after the child also. So what happens here? To make the child busy or to keep the child busy, one monster is given in their hand, and that monster is mobile. Or you can say any other gadgets like iPads, tablets, anything. The child watches that continuously. I have seen a child of 6-month-old or 6-month-old child exposed to screen time for more than 6 hours in a day. While feeding him, while making him engaged, to keep him engaged, these things are done. I am not saying this is the fault of the mother. I don't want to get into that criticism that it is her fault, but she is helpless. So this also, the cause, that is increased use of mobile phones, increased screen time, is causing autism spectrum disorder. It is causing some few traits of autism in the later developmental age of the child. So I think these main two causes one should keep in the mind, rather the society should keep it in the mind and just make favorable conditions for both mother and child to beat this monster called autism.
I talked to Mayuri ma'am. She's a wonderful person. Why is that? Like, she first prepares the mother to help the child. When the mother is helpless, we can't do anything. So Mayuri ma'am first prepares the mother to help the child. Her approach bridges the gap that we usually miss in the normal speech therapies.
As a clinician, what I feel, speech and a social delay are the earliest sign, and that are the emerging. You should not wait once you observe these two signs. Baby will not give you eye contact. Okay, baby will not respond to his or her name also. There is a total lack of pointing, which is again a red flag sign of autism. Baby is totally inert, no facial expression to different emotions. This is one important point I want to mention over here, that baby will not imitate childhood characters or a superhero such as a doctor-patient relationship, teacher-student relationship. Baby will not dance, sing or act. there is a presence of a restrictive and a repetitive behavior. Okay, and baby will follow certain pattern, and if you try to change that pattern, okay, he or she will throw severe tantrums.
To start with, I will say that Nandu को पहले जब मैम ने एग्जामिन किया तो he was just running here and there, उसको कोई अवेयरनेस नहीं थी कौन अपना है कौन स्ट्रेंजर है. मैम ने बहुत फोर्स नहीं किया, मैम ने प्लेफुल मैनर में हमें कुछ स्मॉल डायरेक्शंस दिए, लाइक स्टेयरकेस चढ़ना, उसकी फाइन मोटर स्किल डेवलप करने के लिए उसे मिट्टी के साथ खिलाना जो कि बच्चे को बहुत अच्छा लगता है, आटे से रोल रोल करके बॉल बनाना, उसके साथ बिल्कुल बच्चा बन के खेलना, वो नहीं भी ध्यान दे तो आप खेलते रहो एंड वो आएगा. दैट वाज द फर्स्ट अचीवमेंट आई नोटिस्ड.
Sometimes some babies will show you delayed motor responses and slow cognitive skills, lack of basic services in rural region, non-availability of experts and trained supportive staff. Now, there is no, in India, there is no central registry, okay, there is no screening program. And what is happening, when there is a social delay or a language delay, pediatrician keeps on assuring patient, okay, ki baby will talk, okay, but things are not taking place. And because of this diagnosis of this condition is becoming delayed, and because of delayed diagnosis simultaneously there is a delayed treatment, and we are losing on that golden period of important years.
We started Arula therapy about a month ago, and then based on the recommendation from one of our friends, and what we noticed was there was a marked improvement in understanding level for insurance. So for example, let's say he was saying initially one word for his needs. For example, if he is hungry, he will say just food. He will come to us and just say food. But then he started using full sentences, which was like, I'm hungry, I need food. He knows all these words, but he was never able to form a sentence or talk about this.
So pediatricians have to remember 3 flag signs to diagnose autism. First is, if by 12 months of age the child does not respond to name, by 14 months if the child does not show objects of interest or point out to objects of interest, and by 18 months if the child does not have any pretend play, we can consider the child has got some issue and needs to be evaluated by a developmental pediatrician.
This is an emergency. This can be sign symptom of autism. You should take your baby to your family physician or developmental pediatrician or pediatric neurologist for further assessment. It is very saddening to see that many families are struggling and not knowing what is to be done. In India, not only parents are suffering, but so-called developmental pediatrician and therapists are also left confused about disorder. Developmental disorders are increasing in India, but if you think about autism, the incidence of autism, it has been skyrocketed. The incidence is increasing with time. We can't afford this huge waiting period. There are many challenges with respect to the trained staff. Okay, it is better to train mother herself, and I think Arula is doing a great job. Okay, they are training mothers to give therapy to their autistic child, because what I feel, mother is the only one who is there with child all day. Every child is different, and so it's need. Every mother knows her baby very well. Just she needs to be trained properly, and I think Arula is doing great on this aspect.
We are taking this Arula for Autism program from Mayuri ma'am since he was 2.5 years old. At that time he was not talking any words, like hardly mama or something, but now after like almost 2 years he is able to speak lots of words. His vocabulary is increased. Mango. And we are happy to see the improvements in him with this program.
So when I was a student of, I think it must be third year. So third year students were allotted autism cases. So it was my first day, and a child with autism was given me as a case to handle. I entered the therapy room. I was pretty confident. Okay, I see all other cases. We'll take this child also. But I saw the child and I got literally scared. The child was about 3-year-old. He was screaming at the top of his voice. He was harming himself. He was beating himself. He was biting himself. He was beating his mother. All chaos in the therapy room. I saw that picture and I got so scared. I was like, I am not going to handle this case. How can I handle? I went running to my professor. And then later she handled the baby. But then that time I decided I will never treat these kind of children. They are so hyperactive. They are so difficult to manage. I will not take up autistic cases in my life. Then I got graduated. I started my clinical practice. And after a couple of years, I received a case. A mother came to me. She said, my child is having autism and I want to show him to you. Then I said, I don't see autism cases. I don't treat them. But she said, there is no one in this area where we stay. There is no one, no speech therapist. Please, ma'am, please see him once. I want to seek help from you. That I couldn't say no. I said, okay, you get the child. She came to clinic and that picture was horrible. The child was very hyperactive. The child was very upset. He was extremely restless. She came with the child. He was around 12-year-old, a very hefty, healthy child and hyperactive too. He was trying to run here and there. The mother had put a leash on the child, on his vest, and the other end of the leash was in her hand. She was controlling the child. He was trying to run here and there. She used to pull the leash and she used to make the child sit. And that picture shattered me. The child was treated like an animal, to control him, to make him sit at one position, because the mother was helpless. She said, when he was young, I could manage him. But now he's 12-year-old. He's heavily growing young man. How can I handle him? What should I do? Madam, please do something. That was an eye-opening incident for me. And that was the time I decided I will do something and everything for autism. And I feel autism is reversible if we start at the right time.
I actually talked with Dr. Mayuri Ramdasi ma'am. When I approached Mayuri ma'am, my girl was around 8 years old. So ma'am understood that she is a growing child and so concerned. That concern she showed towards us, we decided that go ahead with the therapy. Ma'am told me that mainly Arula will focus on the concentration and attention skills of the child so that there would be an overall improvement in her. Ma'am also said me that Arula will focus on a strong bonding, the relationship between a mother and a child. 3 things are very important in Arula. The first is consistency. So it is not that one day I am giving her that, one day I am making her to do that, and again there is a break of 2-3 days, and again I am starting that. It's not going to be like that. A consistent therapy have to be given. And the second one was documentation. However is your child, whatever the improvement she is showing, and also whatever the negative behavior she is exhibiting, you keep documenting all that so that it would be very easy for you to have a quick reference and all. So I did that also. And the third thing was patience. Ma'am told me that autism, this itself is a game of patience.
Om Purnamadaha Purnamidam Purnat Purnamudachyate Purnasya Purnamadaya Purnamevavashishyate. A beautiful shlok from Ishavasyopanishad. The beautiful example of this shloka is like this. When the baby is in the womb of the mother is complete. The baby is complete. After the birth, still the mother is complete and the baby is complete. When the baby is in the womb of the mother, he is connected to the mother through the umbilical cord. When the birth takes place, after the birth, this umbilical cord is cut. When the baby is in the womb, he receives all the nourishment, rather breathing, everything is done through this umbilical cord. When the baby is out, this cord gets cut. Now baby is separate and the mother is separate. But still the bonding between both of them is there, rather it increases. Yes, the true meaning of Arula lies here. Arula means the ultimate binding energy. There are three important pillars of Arula. The first pillar is Mother is. Mother is means the ease with which mother talks to her baby. When a mother is trained enough as how to talk to her baby, a successful two-way communication is established between the mother and the child. The child gets bonded with the mother and a very good outcome with respect to speech, language and communication is achieved.
Mayuri ma'am helping the parents, the other things also. She gives some moral support to the parents. We're happy and that we need actually. We need moral support also for our kids.
The second important pillar is development of auditory seeking in the child. When the child outside the commercially running speech therapy centers, when the child is exposed to speech therapy, it is seen that the children, irrespective of autism, typically developing children or it may be autism, but more prominent in autism, they are visual seekers. Because they are lacking in communication, they try to grasp information from the surroundings through the visual sense. That is called as visual seeking. So the therapy centers, what they do, the current approaches, what they do, they develop these kind of visual seeking in the child. Means what? Showing him flashcards, showing him lights turning on and off, different colors, showing him cards or objects and making him speak. But the visual seeking makes the child distractible. We see that there is no eye contact. So to develop eye contact, develop visual seeking. But no, this is wrong. Instead of visual seeker, we have to make our child a very good auditory seeker.
Unlike the other OT and speech therapies, we don't have to just keep on going to the centers and waste our time there and get frustrated with all those harsh therapies. Here, the Arula for Autism is mainly focusing on what the kid needs, and as a mother, how can I help him in a better way.
The listening skills are immensely important in order to develop speech and language. I always say the child who is a good listener eventually becomes a good speaker. So we have to develop this auditory seeking in the child. This is the second pillar of Arula. And as I said, the third pillar, very important, is confidence of the mother. The mother's potential, realizing her own potential to become the guide, the mentor of her own child via developing good listening skills. So when the mothers learn how to develop listening skills in the child, then the path becomes much easier. The communication gets established, the two-way communication gets established, and eventually speech develops. And a developed speech or developed communication with a very good emotional display also, the execution of emotions, feelings also, in turn takes the child out of autism traits. It nullifies the negative or repetitive behaviors. It nullifies his behavioral issues, sensory issues, because the child is able to communicate, is able to express. So these are the three main pillars of Arula on which my entire approach is based, which will lead to successful speech outcomes.
And okay, we took up that, and it was like nearly 6 months since I started that, 6 to 7 months, and we saw her improving. Ma'am started the activities based upon, like, every time when ma'am used to sit for the session, me and ma'am, when we discuss about it, she first used to ask me, okay, now tell me what are all the positive and also the negative changes that you notice. So first she always starts the session with this only. When I say that she's doing this, ma'am is really happy about it. The concern that she's showing towards our child, really I was impressed about that. She was really very happy for the changes that she had. I mean, for the positive changes. And when I say about the negative behaviors and all, she's exhibiting, she's laughing, she's behaving like this in the outside and all. So ma'am gave me activities based upon that. Whatever the child is facing regarding the, with respect to that issue, ma'am was giving me the activities. So that helped the child to improve at a faster pace. Now actually my daughter is 9 years old and she is in grade 4. She's doing good in academics, and she is communicating with the teacher. Whatever the teacher is asking, she is able to say. She is able to give a confident answer to the teacher.
When I studied autism and when I started treating autism, I realized one thing. Though child and the mother, they are bonded, they love each other, they are into each other, their communication bonding is lacking. But in autism, what happens? As the child grows, either he does not pick up the speech and language, or there is a chance of regression which occurs at around 1 year, 1.5 years of age. That whatever milestones with respect to speech development are achieved, they are lost. Gradually they get lost. The child is around 2 years, 3 years, 4 years, but not speaking. How much the mother will speak? She feels lost. So the two-way communication is lost at that point of time. Her flow of speech go on reducing that point of time. And this is where I call it as lack of communicational bonding. What Arula is doing, it is establishing successful communicational bonding between the child and the mother. This is Arula. This is the ultimate binding energy. Arula is a comprehensive approach. Arula is the approach with immense compassion, passion, and knowledge, wisdom towards treating children and mothers with autism?
We have seen in Arula is that they are very focused, mother focused approach. So they train the mothers that can help their autistic child. So what they do is that there are a lot of real life based activities that they do. For example, sit with the child to explain the full cooking cycle of their favorite food. So my wife used to cook his favorite food, my son's favorite food, in front of it, and he's looking at the entire process.
Okay, it is boiling. Tea is boiling, yes.
So that develops the understanding, okay, food is cooked like in a particular way, and then he was speaking a little longer sentences about the process, that what he is doing.
The ultimate goal of Arula is to take every autism child, every child experiencing autism out of autism traits, to reach out every child, every mother, to develop good listening skills in the child and develop good speech, communication, language, emotions, feelings, cognition, academics, and what not.
So up until now, we've gotten a fair share of understanding on what Arula for Autism is and how it ensures that every autistic child is never denied his or her birthright to effectively communicate. Now, let's take a look at exactly how Arula for Autism as an approach functions. So as you probably know, Arula for Autism is the world's first e-learning platform for mothers having children with autism, and how we are the pioneering organization in the country of India to make sure that a perfectly seamless execution of an online speech and language therapy happens in the cases of autism. So currently, Arula for Autism has 3 wings, details of which can be easily found on our website. The first, the complete Arula for Autism course. Second, 1:10 live group sessions with Mayuri ma'am. And third, Arula at your home, therapists at your side program. Now, let's take a deep dive into understanding each one of these. Talking about the first option which you can take while implementing the Arula for Autism therapy approach with your child goes by the name the Complete Arula for Autism course. When you sign up for this course, you get access to 2 of our pre-recorded programs, Arula's 21-day orientation program and Arula's 21-day dynamic program. Every mother must watch 42 days worth of content of these programs alongside attending the weekly twice live sessions of Mayuri ma'am. These weekly twice live sessions of Mayuri ma'am would extend over the span of 1 year, meaning you would be required to attend the 100 live sessions of Mayuri ma'am over the span of the same year. So in these live Zoom sessions, Mayuri ma'am would discuss many other techniques, methodologies, concepts, and a lot of other agendas with you. Also, goals for the coming week would be set, and assessment over the completion of the goals in the past week would also take place. Mothers, in case you would have any grievances, challenges, or if you faced any milestones in completing your goals over this week, you can make use of our live platform to voice them all out, and Mayuri ma'am would resolve to them right there and then. Also, upon taking up this option, you are given your dedicated Arula guide who is always available for you on rest of the days. Say, suppose you're facing a challenge, or you have a question, or you're simply lost on how to proceed ahead with our Arula for Autism program, you can reach out to your Arula guide and they will make sure that you are given your answers in due time. Coming to our second option of 1:10 live group sessions with Mayuri ma'am. If a mother wishes to go ahead with this option, what exactly is she getting? First of all, she is getting access to all the content I've previously mentioned, which goes in the first option of Complete Arula for Autism course. Additionally, if she aspires to have a more exclusive attention, a more personalized approach, and a direct connect with Mayuri ma'am at all times, then she can definitely proceed with the 1:10 live group sessions with Mayuri ma'am option. In this, we make groups of not more than 10 mothers at a time, and these groups, along with the 2 live sessions in a week, are given one extra live session in the same week. This extra live session would be more comprehensive, would be more exhaustive, and may extend to the time limit of up to 1 hour, also on some days. So, instead of 100 sessions spread over the span of 1 year, they are getting a total of 150 sessions spread over the span of 1 year, along with the direct personal connect with Mayuri ma'am. Keeping these differences aside, the mothers who take either of these options are anyway given their set of dedicated Arula guides who would be available for their assistance 24/7. Coming to the last option which we have, Arula at your home, therapist at your side program. This option is probably Arula's most nuanced option when it comes to the execution of Arula therapy. This option can be the best taken advantage of by busy mothers, by working mothers, or the mothers who are having undeniable commitments, due to which they are not able to dedicate that given the required amount of time for the execution of Arula therapy with their child. So under these compelling circumstances, Arula trains the therapist, the set of therapists, and sends these therapists over to the side of these mothers to help them with the execution of Arula therapy with their child. Daily 6 to 7 hours of active Arula therapy execution would be later carried out with this therapist with the child on an everyday basis. At the end of the day, the daily progress reports would be shared with Mayuri ma'am, and her guidance as well as the constructive criticism with respect to the progress made on that day would be taken into consideration right there and then. Also, at the end of every week, a meeting is conducted between Mayuri ma'am, your designated Arula therapist, the mother and the father of the child to discuss how did this week go, the progress made this week, the challenges faced this week, and the lessons which we have learned this week. So, all these inputs are later considered into constructing the goals for the coming weeks. If you're feeling a little confused, lost, or do not know which option is the best for you, don't worry. It's absolutely fine. In fact, we at Arula, we have a special team just to guide you on picking the option which is the best suited for you and your requirements. Ever since you first reach out to us, till when you finally become part of our Arula family, and even beyond that, you would have a dedicated Arula guide to answer each and every query of yours, and if you do not have any, then to just guide you through these meals. Our mothers are our most priceless possessions. They are our strength, they are our pride. So, when you finally enter Arula, you are not just a mom, but you are an Arula super mom.
Basically, Arula says there has to be a very good platform for all the mothers. The coziness, the ease, the relaxed conditions to work with the baby. And the mother who will do this, who will achieve these prerequisites first, she will be very, very successful in bringing out changes in her child. You are not confident. You are depressed. You are not trained because no one trains you. No one gives knowledge to you as what you can do to improve your child. But here, Arula for Autism stands differently. It says, mother, you have 2 weapons, very important weapons. Your voice and your touch. These 2 weapons are enough to bring about immense changes in your child. You use them with the knowledge, with the wisdom, with the guidance, with appropriate advice, and you will see great changes occurring, great achievements occurring in your child. When you are using these 2 weapons, Arula guides you, teaches you. Arula makes you perfect in the utilization of these 2 weapons. And every day becomes a day of celebration. because your child achieves everything every day. So, mothers are very important. And moms, your love, your compassion, your dedication, your surrenderance cannot be competed with anybody. No one can replace you. The love with which you will work with your child, which therapist will work in the world? Who will give that love to your child? Impossible. So realize your own potential. Make yourself strong. And be your child's own speech therapist.